for obesity and its effects on women in their reproductive stages, there are a few things that can happen. So I'll go over each point. The first one I wrote is gestational diabetes. That's basically, hypertension, high blood pressure during pregnancy. I already talked about the correlation between diabetes and obesity. All right, and of course hypertension and obesity as well.
Preeclampsia is hypertension as well as protein in the urine, right? Those are all risk factors, of course, for women who are obese, right? Pregnant women specifically that are obese. Now, next we have hormonal imbalances. So with this one, of course, with obesity comes a higher BMI, right? High BMI tends to equal hormonal imbalances. Reason being is because the excess fat cells tend to produce excess estrogen, right? And what can happen in those cases is it can end up disrupting the ovulation process as well as even the menstruation process. Okay, so you don't really want those either, because of course, if you're in the reproductive window, right, you're in that age group, you could end up, having trouble getting pregnant. So, when those cycles are disrupted, it could cause you some trouble trying to get pregnant. Now, the next thing I have here is you could be looking at increased risk of PCOS. Now, I imagine that most of my women out there listening already know what this is, but that's the polycystic ovary syndrome. Next thing is excess androgen levels. Now, if you are familiar with androgen, it's not necessarily something that women typically produce, because androgen is that's the male hormone. Excess androgen levels can also disrupt your ovulation process and even the menstruation for that matter. So make sure you maintain a healthy weight, eat the right foods, do everything that you should be doing, right? Anything helps. The last thing I had here in this bullet, on this board, you can also increase your child's risk of being obese in the future.